So looking at some of the examination procedures, and these are actually exam procedures that we do as a part of our orthopedic exams, looking at the neurological aspect of it. So testing for the reflexes, which we utilize the reflex hammer and check the deep tendon reflexes. They could be either increased, decreased, absent, or normal, depending upon, if you have a pathology, will dictate one of the 3 abnormal responses. So when you have increased reflexes, that usually tells you that you also have some CNS pathology. And whereas with a decreased reflex, you have some type of pathology either in a spinal nerve root or in the peripheral nervous system. So the classic reflexes that we typically test, you have the biceps at C5, you have the brachioradialis at C6, the triceps reflex at C7, the patellar reflex, test nerve roots L2 through L4, and the Achilles for S1. Then you have testing for the long motor tracts or the cerebral cortex motor neuron pathways, and that is the Babinski sign. So that is the test, and you can see the illustrations. I believe there's an illustration in your textbook on page 368 where it shows what a negative versus a positive Babinski sign looks like, where basically you run the reflex hammer along the bottom of the foot. A normal sign is the toes pointing down. The abnormal response is the toe splaying and the great toe extending. So that would be one sign of a long motor tract abnormality. The other thing is Clonus, which also tests for the long motor tracts. That's where you would move the hand. So basically you passively take the foot or the hand into end range. In the case of the foot, dorsiflexion. In the case of the hand, wrist into extension. And what should happen is there shouldn't be any type of involuntary movement. So with these tests, for instance, if you take the foot and push it up in the dorsiflexion a couple times, when you stop applying the force, the foot should stop moving. In the case where someone has Clonus or has some type of upper motor neuron pathology, their foot will continue to move. It will kind of have sort of an involuntary response once you're done. So that also tests for upper motor neuron lesions, similar to what you get with the Babinski sign. Some other examination procedures that can be performed, you can test for meningeal irritation. So we discussed the meninges in class. You can look at, because there are some conditions where meningeal irritation can occur. The Koenig-Brzezinski test is a test that puts those tissue structures on a strain. It can tell you if there's issues associated with those particular structures. You can do basic sensation and motor testing to make sure that those are all intact. To look at the areas that deal with balance and coordination, you could do a basic Romberg's test, which the Romberg's test is a test where a person typically will stand, and you'll look to see kind of how their balance is. It's basically a balance test that kind of shows how well their balance and coordination is functioning. We are going to talk a little bit more about cranial nerve function and discuss that. An important point to note with cranial nerve function is that if there is an abnormality present, that is a situation where immediate medical referral is warranted. So, and I'm going to discuss that later on in the video, talk about the different cranial nerves and what you'll need to know about those. And another thing is testing basic cognitive function of the brain. There's various ways you can do that. One way is through what's called serial sevens, having somebody counting backwards by 7. There's also various standard cognitive screening tools that can be utilized to objectively measure how well someone is functioning cognitively. So just to expand a little bit on the cognitive testing, there's different types of categories for cognitive tests. The individual cognitive screens, it's kind of what I talked about on the last slide. You can do the serial testing, again, counting backwards by 7s or by 3s can kind of focus on their cognitive ability and their ability to pay attention to tasks that they're doing. You can also test for retrograde and anterograde amnesia. So retrograde amnesia tests for events that happen, for instance, in the case of a head injury, things that happen before an event. Anterograde tests for how well their memory functions after the head injury occurs. So you may have seen this if you've seen somebody do a concussion evaluation. They do the 3 to 5 object recall, where the ATC will name 3 or 5 random things and tell the patient to remember it, and then later on in the assessment they have to repeat it back. That's the test for anterograde amnesia, whereas retrograde amnesia, they'll ask them about what are things that happen before the event. So those are some examples of individual cognitive screens. There's standardized cognitive screening tools. That is, and your textbook talks about some of these. The SAC, the Standardized Assessment of Concussion, that's an example of a standardized screening tool that can be used. Basically a paper and pencil test that can be used for that. There's various balance examinations. The balance error scoring system is something that can be utilized as a screening tool. So there's various things that can be done here as a part of the standardized cognitive screening test that can be done. And then there's neuropsych tests. What these are is these again provide a measure of any type of cognitive impairment. There are both paper and pencil and computerized versions. Probably one of the more notable computerized versions, or an example of that, would be the impact tests, which some of you have probably been exposed to. So those are all different standardized and different types of individual cognitive screens that can be done to test that particular function of the brain. Another thing that can be noted as a part of the exam that can be observed in a patient is are different types of posturing. You have decorticate and decerebrate posturing. The pictures are noted here on the slides. These are things that can be seen when patients have different types of pathologies to different areas of the higher areas of the nervous system. So with decorticate posturing, that's the posture on the slide where you see the elbows and wrists flexed. And that tells you that there are interruptions of signals from the cerebral cortex. So this looks at higher areas of the brain. The decerebrate posturing is the posturing in the bottom. That's where the elbows and wrists are held in extension. And that illustrates that that patient is having interruptions from the cerebellum and in the brainstem. So both of these, again, are indicative of patients that have severe neurological dysfunction. One of the things to note is that, particularly with the decerebrate posturing, that also tells you that there could be potential compromise in the cardiorespiratory centers. So that would be another thing that you'd have to be concerned about in someone who is illustrating decerebrate posturing. So these would be some things that would be potentially observed in someone with significant central nervous system pathology. Some other important inspection points to note when you're looking at your patient that you can observe. Battle sign would be bruising back behind the mastoid process and behind the ear. Potential sign of a skull fracture. The raccoon sign, which would be bilateral bruising around the eyes, again showing significant structural damage to the skull. And nystagmus, which is involuntary eye movement. We talked about that a little bit during the ears, eyes, nose, throat chapter, but again, that would also be a potential sign of significant nervous system pathology. And again, it's essentially abnormal involuntary movement of the eyes. It's also known as dancing eyes. So it's just that involuntary movement that occurs, which would indicate nervous system pathology. So looking at some of the general signs and symptoms associated with the nervous system, Syncope and coma, so person losing consciousness. Obviously, we know a coma is a prolonged state of unconsciousness. Both of those are signs and symptoms of significant nervous system pathology. Paresthesia, or numbness tingling, again shows compromise to the nerves. Again, it's just an abnormal sensation that somebody would have, or the pins and needles that people complain about. Abnormal motor control, coordination, tone. So these are all things that we kind of highlighted as a part of the assessment. Headache. The headache can be caused by various issues. That's going to be one of the conditions we talk about, are the different types of headaches that people can experience and what some of the causes are. Any types of vision, hearing, or just any other senses in general. Again, here you look at, as we had talked about in class, the different cranial nerves, potential pathology or issues associated with that, and just general changes in mental status. So kind of would tell you that there's some type of abnormality in the brain if someone would have a sudden change in mental status. And this is something that you look at particularly with concussions. If somebody starts acting much differently than they normally act, it's not uncommon to see people who get concussions, maybe the patient who's typically very quiet all of a sudden gets very loud and boisterous and starts kind of acting abnormally in that fashion. Or in the reverse, you could have somebody who is, a little more outlandish, a little bit more talkative, all of a sudden gets very quiet. So, be something as a part of, even just a concussion exam, just as an example, something that you can see as far as a change in mental status. Here we just kind of highlight some of the different pain patterns, where they what parts of the nervous system they actually come from. So there's different areas within the spine that transmit different types of information for an individual to perceive. So we have the dorsal spinal columns are responsible for light touch and proprioceptive impulses. So proprioception, if you're not aware of that term, is just the general awareness of where the body is. Okay, so for instance, when you're not looking at a body part, you kind of know, if your nervous system's intact, you know the positioning of the body part without looking at it because you have sensory input coming from that area. That's proprioception. So the dorsal part of the spinal column is responsible for that. The ventral spinal columns are responsible for transmitting pain and temperature. So that area of the spinal cord is responsible for that information. And then you have your peripheral nerves. So those are the nerves out in the periphery. So we know we have the central nervous system, which is the brain and the spinal cord. From the spinal cord, we have nerve roots, and then those nerve roots branch out into the rest of the body to form your nerves that you have in the periphery. And those nerves are responsible for sensation. They're responsible for autonomic function, so the involuntary function, all the nerves that innervate, your gastrointestinal system, your breathing, all of those functions that are involuntary. And then the motor control, or your voluntary responses, come from the peripheral nerves as well. So one of the things to kind of connect with the nervous system is, again, knowing the structures and potential pathologies involved. So as you're going through the pathologies, having an understanding and awareness as what part of the central nervous system they affect kind of clues you in. So both for testing purposes and then just clinically going forward, being able to recognize when somebody has certain signs and symptoms, kind of what gets connected to the specific structures in trying to determine what's affected. I'm highlighting in this slide table 13.7 on page 373 shows you what central nervous system structures are affected, along with potential pathologies depending upon the signs and symptoms that are involved. So, in class we've discussed the different structures of the central nervous system, the cerebrum, basal ganglia, the midbrain medulla, cerebrum, and spinal cord, and what signs and symptoms you're going to see. So for instance, if someone has altered breathing patterns, someone sustains a what appears to be a severe head injury, and they have altered breathing, cranial nerve signs and symptoms, that tells you that there is a pathology to the midbrain and medulla, because that's where, again, that would potentially come from. So again, review that chart along with, again, looking at the notes from the structures, so that you can again make a connection between some of the pathologies that are going to be described along with their corresponding signs and symptoms.